So we have talked about valvular problems and the impact of the valvular problems on the ventricular pressure loop. And we have learned how to diagnose changes on the ventricular pressure loop. What we want to do next is sort of home in on different murmurs that can occur whenever we have various valvular problems. Now, let's recap and quickly revise. If this is the ventricular pressure loop that we are looking at, remember we said that this represents closure of the mitral valve. And when the mitral valve closes, this represents S1. S1, the first heart sound, and as you can see, as isovolumetric contraction takes place. At this point, the aortic valve opens, we eject blood, and at this point, the aortic valve closes. As the ventricle have begun its repolarization, the closure of the aortic valve will now be represented or give us S2, the second heart sound. Now, if we are going to have a murmur, we said the murmur can either be systolic or the murmur can be diastolic. If it's a systolic murmur, what are the various pathologies that can give me systolic murmur and the variations in the sounds or the duration of intensity of the murmur? For example, if we have aortic or pulmonary stenosis, stenosis of the aortic valve or pulmonary valve, we can have an ejection murmur, which will occur during systole. This murmur is often described as being crescendic and decrescendic, an increase in intensity and a decrease in intensity. Another kind of murmur we can have in systole, for example, if we have mitral tricuspid regurgitation. This can also give us a systolic murmur. What kind of murmur will we give? We will have throughout systole what is referred to as a pan-systolic murmur. Notice the evenness in the intensity of the murmur. And finally, in late systole, if we have mitral valve prolapse, which is rather common, especially in young women, what can we have in mitral valve prolapse? We can have what is called a late systolic click. These are the variations of a systolic murmur that we can have. What about if we have a diastolic murmur? Of course, when would a diastolic murmur occur? A diastolic murmur would occur between S2 and S1. So what will this look like? If we are going to have diastolic murmurs in diastole between S2 and S1, example as in aortic or pulmonary regurgitation, when the aortic valve is regurgitating, of course, it will regurgitate during the diastolic filling of the ventricles. And this will give me a murmur that decreases in intensity in early diastole. A murmur that decreases in intensity in early diastole. If I have mitral or tricuspid stenosis, this can also give me a diastolic murmur. This will more be a mid to late murmur. As you can see, we have a mid to late murmur. Mitral stenosis, tricuspid. And again, in mitral stenosis, we are going to have a gradual decrease in the intensity of the murmur during mid or late diastolic interval. Therefore, these are the various murmurs that can occur in the heart. Let us conclude with a few salient points that I want you to remember for the USMLE. First and foremost, when we are talking the cardiac cycle, I want you to remember about the pressure volume loop. I want you to remember where are the valves in the pressure volume loop. Where does the mitral valve open? Where does the mitral valve close? Where does the aortic valve open and where does the aortic valve close? I want you to remember that little trick. If the exam changes the axis with pressure and volume, we must be able to derive where the different valves are. Third point I want you to remember, ventricular pressure tracing. How different valvular problems or pathologies can affect the changes in the ventricular pressure tracing. If we have, for example, aortic stenosis, what will happen? you must recall immediately, I will have an increase in ventricular pressure. I will have a pressure gradient between peak ventricular pressure and aortic pressure. If I have aortic insufficiency, how is the ventricular pressure tracing affected? Or how is the ventricular pressure affected in aortic insufficiency? Peak ventricular pressure increases, but there is no pressure gradient between peak ventricular pressure and aortic pressure. What about if I have mitral valve pathology? If I have mitral valve pathology, if I have mitral stenosis, what changes would you expect in the ventricular pressure tracing? Would we expect any increase in ventricular pressure, peak ventricular pressure? No, that should remain within normal limits. If we have a mitral valve pathology, we should look for changes in atrial pressure. If the atrial pressure increases, as we said, in mitral stenosis, when will the atrial pressure increase? That's right, it will increase during diastole. I'll have a diastolic increase in atrial pressure being greater than 15. In mitral insufficiency, what would we expect? We'll expect changes in atrial pressure. What changes would we expect? We'll expect the atrial pressure to increase. And where? In mitral regurgitation. It will occur during systole. I will have an increase in the atrial pressure during systole. If we can remember those points, that will help us a lot during our exam.